Hi everyone. Today I am giving you information on the topic retinopathy of prematurity. So let's move to its introduction. Retinopathy of prematurity, it is also known as ROP. It is a vasoproliferative disorder of the retina which occurs principally in the preterm infant. It is a vasoproliferative disorder, means it is a kind of disorder which affects the abnormal growth of the blood vessels. It mostly affects the blood vessels, and in this abnormal growth of the blood vessels takes place in the retina. It only affects the infants which are immature and they have incompletely vascularized retina. It only affects those infants who are immature, who are born before the 9 months period, and they have incompletely vascularized retina. Now if you can see the retinal structure, so this one is the normal retina in which the normal growth of the blood vessels occur, and this one is the abnormal growth of blood vessels. Here the blood vessels starts growing, they becomes too weak, and there is a leakage or the clots of the blood. So in this way the blood vessel starts growing in case of the ROP disease. So in milder cases there is no effect on the vision. In milder cases vision doesn't get effect, but in advanced cases it can cause bilateral irreversible total blindness. In advanced cases it can cause bilateral means it affects the both eyes, and irreversible means it can't be reversible. Vision can't be reversed. If once the vision gets gone, then it means it has gone. No need, we can't take it back, and it leads to the total blindness of an infant. Next one, let's move to the risk factors. What all are the risk factors responsible for the ROP? First one is the premature birth. If a child takes birth before the full time period, which is the 9 months, before the 9 months it leads to the premature birth. And there are the risk factor for the ROP. Excess oxygen. If excess oxygen is given to the infant or the child comes in contact with the excess oxygen, then it is one of the risk factor of it. Vitamin E deficiency. Next one is the apnea. Apnea is a condition in which the breathing gets starts or stops sometimes. There is also a sleep apnea, means while sleeping the child stops breathing. So abnormal breathing cases, sometimes it stops breathing and sometimes takes breathing, so this is the apnea. Due to the breathing the oxygen rate become reduced, due to which the ROP occurs. And next one is the sepsis. Sepsis is a kind of harmful blood infection which affect the child most after the 28 days of the birth. Next one, high carbon dioxide. High carbon dioxide occurs and they reduce oxygen, and sometimes the excess oxygen also affects the ROP. Next one is the bradycardia. Bradycardia is a condition in which the heart rate becomes slow. Normally if you can see the children heart rate becomes more higher as compared to the adults. Blood transfusion is the another factor which is responsible for causing the ROP. Birth weight less than 2500 grams. If the birth weight of a child is less than 2500 grams and the gestational age is approx 30 weeks, then it comes under the ROP. So screening of the ROP is important. Next one is the locations of ROP. Now there are the 3 zones which are made for recognizing the ROP. Zone 1, zone 2 as well as zone 3. Let's see one by one. An imaginary circle, the radius is twice the distance from the disc to macula. If you can see in the diagram, then this one is the disc, the yellowish part is the disc, and this one is the macula. Okay, so double the radius of both, the diameter is considered, and this all area comes under the zone 1. Okay, next one is the zone 2. Zone 2 extends from here to the ora serrata area. Here the ora serrata area is there, from where the formation of the retina starts. That one covers the zone 2. Okay, so the leftover part is the zone 3, and we can see it by using the clock hours: 12 o'clock, 6 o'clock, 3 o'clock as well as the 9 o'clock. Okay, so all the 3 zones are looking in this way. Next one is the zone 3, residual temporal crescent. So if you can see for the both eyes, this one is the right eye and this one is the left eye. Okay, so zone 1 is seen in this way, zone 2 as well as the leftover part is zone 3. here the 3 o'clock and 9 o'clock. This one is the nasal side. Okay, the nose should be present somewhere here. So in this way the children get examined in case of ROP in a proper dilation by using the speculum. Next one, stages of ROP. Here are the 5 stages of ROP. Stage 1, 2, 3, 4 and 5. So let's see one by one. In stage 1 there is a vascular retina, demarcation line which separate the vascularized retina and the non-vascularized retina. Third one is the avascular retina and the lens. So let's see. Here is the cornea. This one is the iris, zonular fibers which are attached to the lens. Okay. So here is a vascularized retina. If you can see, the blood vessels are present here. Due to the presence of the blood vessels, it is known as a vascularized retina. And this one is the avascularized retina. No blood vessels are there. Okay. And there is a demarcation line in between them. So there is a line which is a demarcation line and it separates the vascular retina as well as the non-vascularized retina. This one is the stage 1. Nothing is there, only the vascular retina as well as avascular retina are separated by a demarcation line. Next one, stage 2. In case of stage 2, that demarcation line becomes thickens. Okay, it becomes white in color and it becomes thickened. So this one is the demarcation line. It becomes thickens. In stage 3, extraretinal fibrovascular proliferation. Okay, so at the demarcation line, if you can see, so there is a fibrous growth present here. Okay, this is the extraretinal fibrovascular proliferation which separates the avascular retina as well as the vascular retina. Next one is stage 4. In stage 4, fibrous material attaches to the zonulars and lens and subtotal retinal detachment. So this was the fibers. They are start getting attaching to the zonular fibers. These are the zonular fibers and this one is the lens. So this whole material start attaching to the lens as well as the zonular fibers, and there is a subtotal retinal detachment, means the retina get detached from the other layers. Okay, retinal detachment starts here, but here is a subtotal retinal detachment because it pulls out the retina. The whole fibrous growth pulls out the retina, due to which it is a subtotal retinal detachment. Next one, stage 5. In case of stage 5, totally detached retina, the retina becomes totally detached. If you can see here, the detachment occurs. Retina gets collected into a single side. Next one is dense fibroplasia. That fibroplasia growth or fibrous growth becomes dense. Fluid in the eye cannot drain. Now there is a fluid present in the eye because there is a no space of the fluid to be get drained, which is formed by the ciliary body, and it is very important for maintaining the intraocular pressure. So there is no space to drain the fluid. That is why the glaucoma occurs. Next one, edema of the cornea. Cornea becomes edematous due to the abnormal passing of the oxygen. White mass press on the lens. White mass, that fibrous growth presses on the lens because there is abnormal growth of it. And next one is the tearing. So all these things results in excessive tearing. Watering starts from the eye. This one is the last stage of the retinopathy of prematurity. Now ROP screening. Babies born before 27 weeks gestational age, those babies which are born before the 27 weeks of gestational age, means it is up to 26 week and the 16 days. The first ROP screening examination should be undertaken at the 30 to 31st week of post-menstrual age. Okay. Next one, those who are born in between the 27 and the 32 weeks of gestational age, that is up to 31 weeks as well as the 6 days, first ROP screening should be examined between the 4 to 5 weeks of postnatal age. Next one, babies more than 32 weeks of gestational age but birth weight is less than 1501 grams. First ROP screening should be undertaken between 4 to 5 weeks from the 28 to 35 days of postnatal age. So screening is very important. If there is a abnormal or the premature birth takes place, so screening of ROP is again very important. Next one, treatment. Treatment can be done at any age or any stage. Lasers can be given to the children. Scleral buckling is done in cases if there is a retinal detachment. Okay, and vitrectomy is also done in those cases in case of the retinal detachment. Both are the retinal surgeries as well as both risky surgeries, okay, to detach the retina, to keep the retina at its place. Prognosis, progression despite appropriate laser treatments. So progression depends upon which kind of laser treatment should be given to a child. Other findings of regressed ROP. Sometimes the ROP get regressed. Regressed means it gets stopped at some stage without giving any treatment. If it gets stops, for example, it moves to the second stage and it gets stops, or the third stage and it gets stops. So the other findings are myopia. Myopia means the image will be formed in front of the retina, so the patient become myopic, means minus number should be given to the patient. Next one is anisometropia. Different kind of, or there is a difference in the power of the both eyes become more than -3, or one eye, the power of the one eye is -1 and the other eye is -4 in case of isometropia, matlab difference between both the eyes. Next one is the amblyopia. The vision of the one eye becomes less, or the both eyes become less because it affects the both eyes. Strabismus. Strabismus means misalignment of both the eyes. And next one is the retinal detachment. Okay, RD gets happen to a child. This was the end. Thanks for your patience listening.